The treatment for an enlarged prostate gland will depend on how badly the symptoms are affecting your quality of life, and the main treatments available can be split into lifestyle changes, medications, catheters, and finally surgery plus other specialist procedures. Now in this video I'm going to take you through 8 simple lifestyle changes and conservative measures that don't involve medications and surgery, many of which are simple and easy to follow, and they can make a significant difference to your quality of life. As ever, this is intended purely as an educational video, not a clinical advice video, and if you are having any issues with your prostate, such as peeing more at night, struggling to pee, or changes in the way that you're peeing, you should always speak to your own doctor. So now let's get into the video. So if you have been diagnosed with an enlarged prostate, then the first thing to do is to try drink fewer fizzy drinks, so things like pop or soda, as well as less alcohol, caffeine and artificial sweeteners. And that's because these drinks can irritate the bladder and make urinary symptoms that are associated with an enlarged prostate, such as struggling to pee or peeing at night time, much worse. Secondly, try to reduce the amount of fluids that you're drinking in the evening, and try to avoid drinking anything for 2 hours before you go to bed. Now this might help you avoid getting up in the night, but try to make sure that you're still drinking enough fluid, especially water, earlier in the day to ensure that you stay hydrated. This is going to be really important for your overall well-being as well as your kidney function. Thirdly, remember to go to the toilet before long journeys, or when you know that you're not going to be able to reach a toilet easily. Psychologically, this can help a lot. The next tip is to try double voiding. This is basically where you wait moments after you finish peeing before trying to go again. It can help you empty your bladder fully, but don't force it by straining or pushing hard. If it happens, and that's great, but don't put pressure on yourself to do this. Another simple thing to do is to try check with your doctor to see whether any of the medications that you take, such as antidepressants or decongestants, might be making your urinary symptoms worse. If they are, your doctor might look into changing these medications, or if you no longer need them, potentially stopping them altogether. Eating more fibre, which is found in fruit, vegetables and whole grain cereals, can also help you avoid constipation, which can put pressure on your bladder and make the symptoms of an enlarged prostate around peeing worse. Now, if you find that your urine is leaking slightly onto your underwear and causing you to feel embarrassed or uncomfortable, then 2 options are to either use some absorbent pads or something that is called a urinary sheath. Now this looks like a condom with a tube coming out of the end. The tube connects to a bag that you can strap to your leg underneath your clothing, and it collects the urine instead of it leaking onto your clothes or underwear. The other really important conservative measure is bladder training. This is an exercise program that helps you to last longer without peeing and hold more pee in your bladder. Now I've included a link to useful resources in the description box of this video which takes you through how to do bladder training at home, which I hope you're going to find useful, but in general this is all about making the bladder stronger. Now with bladder training, it's a good idea to use a bladder training chart to record firstly each time you pass urine, and secondly the volume of urine that's passed. And again, I've included a link to a free version of this in the description box of the video in case you want to download it and use it. With bladder training, you'll also be taught several exercises such as breathing, relaxation and muscle exercises to help take your mind off the need to pee. You'll be given a target such as waiting 5 to 15 minutes when you feel the urge to pee, and over time you'll then gradually increase how long you wait. At the end of the program, you should find that you're able to last longer without peeing. Now, there is of course a role for medications and surgery plus other procedures in the management of an enlarged prostate, but these lifestyle changes that I've mentioned here in this video can be quick, easy and effective methods that can go alongside these more advanced treatment options. Remember, ask your doctor or specialist nurse for more information about any of these lifestyle changes, and for more information please do check out the resources in the description box of this video. Finally, stay tuned for more information about enlarged prostate glands which I'll post on this channel, and until next time, thanks for watching and bye.